All right, so I'm glad that you all could make it. We're going to talk about platelet-rich plasma for hair loss. Platelet-rich plasma is going to be abbreviated PRP because it's a real mouthful to say every time I mention it. And we're going to talk about it for both male and female pattern loss. I like to define things. I think it helps me understand stuff, and I think it will help you understand it too. Alopecia is just the word that means hair loss. Whether it is partial or total, whether it is temporary or permanent, it just means hair loss. So the types of hair loss we're talking about today, male pattern loss, which is known as androgenetic alopecia. Androgens are male hormone, and that is what makes hair follicles, the factories for making hair, miniaturize and go to sleep. It is genetically controlled. Both men and women can have male pattern loss, but it's typically seen in men only. We have telogen effluvium, which is 90% of what I see in women. It is a self-righting temporary kind of hair loss, and it is induced by a stressor, not by stress. We all have stress, and if stress caused hair loss, we would all be bald. Right now, a stressor, enough to rock your world. Pregnancy, death in the family, tax problems, anything that's going to mess with the growing to resting ratio of hair, which is typically 80% growing and 20% resting. And it shifts, and for people like Crystal Gale, if you remember her from the previous century, she had hair down to her tush. She had a really long growing phase. People with short, fine hair typically have a very short growing phase and a much longer sleeping phase or resting phase. I believe in treating things. There are a lot of people out there who will say, oh, telogen effluvium is temporary, it is self-righting, self-correcting, it will go away by itself. From the day we diagnose this, it might take 6 months, it might take 3 years to right itself. So I think that doing things that are going to help and not going to hurt, are valuable. And then ultimately the patient is the one who decides what he or she wants to do. So for telogen effluvium, we use Nutrafol, which is a new biologically active set of vitamins with a lot of good paper behind it. Paper is important. We have double-blind studies. They're not the only thing that I hang my hat on, but it is something that definitely can help and not hurt. I use cortisone, both injected into the skin as intralesional into the sites, and as a full strength injected into your muscle, an intramuscular injection for a full body effect. And we are presuming that it is decreasing inflammation because something is causing your hair follicles to go to sleep. And that is inflammation induced by that stressor we talked about just a moment ago. I use a medicine called spironolactone. It is only used in women. It is labeled for high blood pressure. We use things off-label because every medicine has more than one effect. And in this situation, it blocks male hormone. We're not going to use it in guys because it affects men's sexuality. It doesn't affect a woman's sexuality. We start at a low dose and work our way up. And because it is a high blood pressure medicine, we go slowly. We don't want to make you feel dizzy because your blood pressure is too low. We use something called Curatrix shampoo. It strengthens hair shafts. It's got a lot of protein in it. It's a good adjunctive helper therapy. Minoxidil is very popular. It was first coming out when I was in high school. And my dad used to crush the tablets, mix them with things, pour them through a filter, and I would bottle them before Upjohn had minoxidil and Rogaine as a product. It works well. We don't really know why. It works best on the top of the scalp and not here. And it was originally mixed in a vehicle that caused a lot of irritation on the scalp. So a lot of people don't tolerate it well. And let's be honest, it's really difficult putting in oily stuff in a woman's hair twice a day for 3 to 5 months. So it's not a great choice in terms of therapy. For male pattern loss, we typically use Nutrafol. For men, we use finasteride and dutasteride. These are medicines that were originally described for benign prostatic hypertrophy, the enlargement of the prostate. Women don't have prostates, so they don't have any problems with that. It blocks the conversion of hormone, testosterone, in the scalp and the prostate into its active form, and that's how it helps hair growth. It definitely helps reduce hair loss. A minority of people are going to get some growth from it, Dutasteride is a second generation, and it blocks about 90% of the conversion. Finasteride, the original, as a trade name Propecia, blocked about 60. The concern for men is that it's going to affect their ability to achieve and maintain an erection, their ability for sexuality. I've never seen a problem with it in all ages. We've talked about minoxidil. Platelet-rich plasma is what we're here primarily to talk about. Transplantation, hair transplantation. I do micrograft transplantation. This is where we take hair from the back of the scalp in skin and transplant it into the front into tiny little openings. It works very well, and it is a very good surgical technique. It's not what we're here about to focus on today. And that brings us to Nutrafol. It's standardized. I am sure that you've been in GNC or vitamin shops and they said, oh great, we've got the hair, skin, and nails formula, we've got biotin, we've got vitamin D. They work, and I use them. And some people don't want to use Nutrafol. They want to use what they bought. They want to use Viviscal. That's okay. Whatever makes people happy. And I think that people buying into their therapy is really helpful for them. There is placebo effect. But when we're talking about something that is medical grade, that has a lot of good and effective ingredients, including something I thought was really great, ashwagandha, which I understand is quite near Wakanda in terms of the Black Panther movies. I'm very excited to go visit. I went back and read some of the studies on horsetail extract because I had not been familiar with that. There is clinical evidence that it does help reduce loss and grow hair. Saw palmetto is the naturally occurring finasteride that blocks the conversion to active testosterone in the scalp and the prostate. Resveratrol is found in grape skin. That is where it's famous from. It is a very potent antioxidant. It's got peer-reviewed studies. And while I am definitely not an evidence-based physician, because I will use anything that's going to work and not hurt, I think that peer-reviewed studies are really great to have. Now, we're talking about platelet-rich plasma. It is your own blood. We find that all of the growth factors that are encompassed in platelets, when you cut yourself, the first cell on the job is the platelet. It goes in there, it releases a whole bunch of growth factors. In and of itself, it grabs onto other platelets to help start the healing process, to help form the scab. It's natural and safe because it is indeed you. It doesn't sting or burn when it's injected. There is nothing, it's purely a neutral pH. How do we get it? We don't go to the store. We draw your blood, we spin it down, we draw off the clear part, we activate it with special factors in that tube, we put it into a syringe with a very small, fine needle, and we inject it back into your scalp. This is what it looks like after it's been drawn up into the tube and spun down. You can see that clear part, platelets and monocytes, which are all types of blood cells, and all of the exciting growth factors that we want. There's a big gel separator, and all of the stuff, these are red blood cells. There's a lot of inflammatory factors in it that will hurt if we inject it back in. That's why, although it is called the vampire facial, we are actually not injecting blood into your face. We're injecting plasma into your face, or in this case, into your scalp.
And what color is the plasma?
The plasma is that straw-colored, clear-colored portion of the blood. So, I think hair loss needs a combination of therapies. Natural ingredients, when you've got them, I'm always looking for things that help most of the people most of the time. And with PRP, it's you helping you. So now we're going to go and inject and take a look at how it's actually done. So, Marlon, thank you.
Yay.